Greetings, this is Parindra-Ra. I am here to do a video today on how ginger is effective. Today's video is how ginger is good for the heart. Ginger is good for the heart because it relaxes the muscles, nerves, and blood vessels by possessing a hefty amount of magnesium, which is essential to the heart functioning at its peak performance. 2021 article posted on the National Institutes of Health website lists this from their findings on ginger, on studying ginger. The objective, the current review deliberated phytochemical properties, as well as the ginger constituents' biological activities and health benefits in several diseases, with particular attention to cardiovascular complications. Comprehensive search was conducted using multiple databases, and they were collected from inception until August 2019. Results: recent years, several herbal medicines were used to develop new drugs with more potency and also minor side effects. Amongst natural entities, ginger is used as a traditional medicine in several diseases. The cardioprotective effects of ginger are contributed to its cardiotonic, meaning it tones the heart, good for the heart muscle. Antihypertensive, meaning it works against high blood pressure. Anti-hyperlipidemia, it does have a fat burning effect to it. And antiplatelet effect. Therefore, it can thin the blood. So anyone taking a blood thinner should either not use ginger, probably not use ginger is best. So the study revealed biological activities, health benefits, and cardioprotective properties, heart protective properties of ginger, along with related mechanisms of action, which gave new insights to show new avenues in the treatment of cardiovascular disease. When the body is sufficient in magnesium, blood pressure is regulated, blood sugar is regulated, makes protein, bone, and DNA, proper muscle function, proper nerve function. When magnesium deficiency arises, abnormal heart rate, personality changes, stiffness, muscle spasms, numbness, and tingling can occur. There's 75 some odd medications that are known to interact with ginger. Aspirin is one of them. That would be Bayer, Tylenol. So because aspirin is also a blood thinner, and ginger being a blood thinner, it's not a good mix. Here's the ginger tea. You could pause this video and take a look at this, how to make this ginger tea. It's pretty simple, self-explanatory. I believe I got it here pretty well. And don't use it within 2 hours before or after any medication. Now, I do want to add some more information on here. Let's go to Tylenol. So it's like with taking medications, there's a catch-22 effect. You know, again, the doctors are chasing numbers, you know, for your medical chart, for your health. They're just checking numbers. As long as they get their numbers, then they have a study, they have record that everything is going right. Or going as recorded, you know. Talk to your doctor before using ginger with aspirin. Yeah, yeah. Of course, they want to always say this: do not stop taking any medications without first talking to your doctor. I will make a video on the best way. We'll make a video on safely uh, discontinuing medication. But for now, this is aspirin. Give me what I'm looking for here. This up. So these are serious side effects of aspirin. Check with your doctor. Immediate side effects occur while taking aspirin. So doctors sometimes tell a patient to take aspirin because they say it's good for the heart, it's good for preventing stroke, and how they how this medicine how the doctors use the medicine to prevent stroke is thinning the blood. So one thing that's important about thinning the blood is that what there's oxygen in the blood in the red blood cells. So if you thin in the blood, you're going to thin the oxygen in the blood, and it's also going to cause issue. So here's I'm going to go over some of the side effects of this medication. I'm just looking for the cardiovascular because that's what the topic's about. Chest pain or discomfort, irregular heartbeat. Now this is they say to take the aspirin because it's good for the heart, but as you see here, causes an irregular heartbeat. But this one's not with the. It doesn't deal with the heart. The yellow eyes and skin. There's a condition called jaundice. That means the liver is not in great shape. It's hurting. It's the liver's toxic at that point. It's having trouble doing its job of filtering all of the drugs and things that has been put inside of the body. But this part isn't for the heart. It's not about the heart, but I think this is important that it can cause renal insufficiency and failure. So this is kidney failure from taking aspirin. So what can happen before kidney failure is person's kidneys are hurt to the point where they might be diagnosed with diabetes, you know, and then the doctor will question us and ask what our family history is, and if there's someone else diabetic, yes, diabetic, it runs in your family, and now you're not even looking at, hey, the only thing I take is this Tylenol. You're not looking at that, okay? See now, hematologic refers to blood. So increased bleeding tendencies because it thins the bloods and the blood platelets. Person can end up having trouble stopping bleeding because they're just bleeding so long. This part, see, now this is precisely the catch-22 right here. Disseminated intravascular coagulation, pathological process characterized by the widespread activation of the clotting cascade that results in the formation of blood clots in the small vessels throughout the body. So the doctor will tell you to take Tylenol, aspirin, so you don't get blood clots. But it says right here, most people probably won't look this word up. I didn't know what it meant. I've been in medical field over 200 years. But what caught my eye, what I did, intra means inside. Vascular is referring to the vessels, blood vessels. Coagulations, it's clot. So I'm like, okay, there it is right there. It had another word on there. Thrombocytopenia is a condition of low platelet count in the blood, which can cause bleeding problems. So that's what happens. Like I said, that's the kind of catch-22 as well. It's it's the purpose is so you don't get blood clots. How do they do that? By lowering the platelet count, disseminated intravascular coagulation, pathological process characterized by the widespread activation of the clotting cascade that results in the formation of blood clots in the small vessels throughout the body. That is not helpful to someone um, looking to prevent stroke, right? So what is said about Tylenol, aspirin, they're non-steroidal anti-inflammatory drugs. Oh, it's right there. See that? I mean, it's already there. This is known. This is why I call this a Ponzi scheme. Oh, surprised they even say it. This is on Mayo Clinic. I don't get a lot of information from them, okay? Non-steroidal anti-inflammatory drugs, NSAIDs, do they increase my risk of heart attack and stroke? Yes. This was just a couple weeks ago. This article was posted. Yes. Non-steroidal anti-inflammatory drugs can increase the risk of heart attack and stroke. Okay. So this article is on the website of International Journal of Cardiology. They're excited. Ginger is now exciting considerable interest for its potential to treat many aspects of cardiovascular disease. This letter reviews the more recent trials, which suggest that ginger shows considerable anti-inflammatory, antioxidant, antiplatelet, hypotensive, and hypolipidemic effect in vitro and animal studies. Human trials have been few and generally used at low dose with inconclusive results. However, dosages of 5 grams or more demonstrated significant antiplatelet activity. So for someone concerned about blood clots, consuming 5 grams, and you're not on medication that's a blood thinner or contraindicated with ginger because of interaction, then consuming 5 grams or more if you're prone to blood clots. Okay, so garlic. Garlic helps the immune system because it's a really high or really strong antibiotic, anti really strong antibiotic, antiviral, antifungal. It can also lower cholesterol. It can help with blood pressure, right? I know some people like to take garlic. I like to eat garlic. I haven't had any in probably 2 months now. My reason for not consuming garlic at the moment is because of its high acid. It's high acidity. It's good for blood sugar levels, gut health, other potential benefits. But the reason is good at these things is because of what it has inside of it. So me being uh, somewhat skeptic to, or I should say cautious of garlic, I choose to eat other foods that have these same things in it. Vitamin C you can get from oranges, any citrus fruit, grapefruit, zinc, iron, potassium, magnesium. Magnesium, ginger is the way. I'm going right back to ginger. I'm riding with ginger. Zinc, foods with zinc. I mean, you can easily do a search for these things. Like, let's say zinc. Zinc plays a crucial role in various bodily functions. It is essential for wound healing, immune system function. See, it's inside of the garlic, the very acidic garlic. DNA synthesis, protein production, growth and development. Zinc is necessary for senses of taste and smell, skin health, and insulin and thyroid function. Um, but anyway, zinc is inside of garlic. Topic of this video was about really about just the ginger and that was good for the heart. Um, I had to tell you, I had to share some other information. I think this is the end of this video. Thanks for watching. Peace. Love you.